Okay, thank you. We'll try to be brief as we can. We know time is very short, so we're going to tell you about our Inclusion Health audit tool that's been done through the Health and Wellbeing Alliance. I'll kick off in there, Sarah will do a bit, and I'll come back at the end. So the Health and Wellbeing Alliance was set up by Department of Health, Public Health England and NHS England. 21 charities have come together to work closely with health and try to look at integrated working across the piece and bring in the charitable sector closer to health and really kind of sharing information across, trying to connect communities, having people with experience in the room and having their voices front and centre in the work that we're doing together with health, looking at how we can deliver health in the voluntary sector well as well, and then the kind of key co-production piece that we do alongside our partners to reduce health inequalities as our ultimate goal. So the background of Inclusion Health, really what it's all about is, obviously you know about Inclusion Health groups, which are homeless people, sex workers, vulnerable migrants, and there's one more I've forgotten, gypsy travellers, of course, as Sarah represents. And this group clearly have quite high levels of health inequalities, and the goal is really to kind of meet their needs through the work we're doing and understanding that the population that we're working with really has quite poor health outcomes than the general population, so it's how we can actually address that through our work. So the project we're looking at doing is, is basically a bit of work to try to develop a tool to help charitable organisations work in a way to audit and improve the way they work with health, Inclusion Health groups in particular, and look at health inequalities being addressed through that. So it's kind of looking at where they can actually audit themselves through the tool to find out where they are on that scale and how they can actually improve their working with Inclusion Health groups, looking at equality, diversity and inclusion on that. So I'll pass you over to Sarah, who'll tell you a bit more about the project and what we did.
So we first of all began, as Caroline mentioned, then there's 21 members within the Alliance, each looking at different aspects of inequality, be that deprivation, protected characteristics or inclusion health. So we audited the partners and asked people what groups they were working with and what they meant by when they said they're working with those groups. And we held a series of workshops. So the workshops were first of all with groups who would consider themselves to be experts in inclusion health, whether with one group or multiple groups within inclusion health, involving experts by experience from inclusion health communities or groups as well. We then held a workshop with a lot of organisations who felt that they wanted to work well within inclusion health, but had tried and reached some barriers and required some extra help. And then we had a third workshop then with people who've been involved throughout the project, where we tried to define what does a good voluntary sector organisation look like that is doing positive work around inclusion health and is positively improving people's health outcomes. And with that then we came to define a list of, it was 25 questions for service providers and 27 questions for umbrella organisations, and they covered governance, planning and strategy, human resources, service delivery or member services, depending whether the type of organisation, and communications. So we developed 25 or 27 questions that would be a benchmark as to whether people will be performing well or not. And basically the goal then was to create an audit tool, which you can find online, and I'll share the link at the end of the presentation. So that the audit tool diagnoses gaps in people's information or performance or practice around supporting inclusion health groups. And then what it does, for every single question that you answer, it provides tailored guidance that would help you to improve and get to the next level. So no matter what stage you're at in the process, there's something to learn because no one's quite got it right with all groups, have they? And then at the end of it then, people will be presented with a guide. So there's 450 trillion different combinations of guidance that can come together, so that gives you an idea of just how tailored it is. And all of the work then was built upon previous equality and diversity work, especially work that had been done around protected characteristics before. What we didn't want to do was scare people away and make them think they've got to reinvent the wheel and do 10 more tick box activities for every patient they had in front of them, but to build upon what already existed. So the tool takes 15 minutes to complete. Each question acts as a diagnostic tool, and organisations who perform at a certain level then can download a benchmark. It's an inclusion health benchmark that they can put in their website or in their promotional resources. And as I said before, yes, that creates a guide.
Okay, so what's next? So do come and see us later. We'll be in the coffee area at 3 o'clock. And we can give you a demo of the tool if you'd like to have a look and see how it works. We can show that to you. If you can't do that, then find it at www.inclusion-health.org. You can have a go at doing a mock one there. How it works, when you've gone through the questions, as Sarah said, you get a report at the end of it, which you can take away with you and use in your organisations. do have a look at the tool and try to see if you can embed the actions through your networks, and let us know what you think of it as well. If it needs to be amended, we're happy to do some work on that if we can get funding to do more work on it. But do contact Sarah at Dutch Travellers Wharf Base if you'd like to know a bit more about the tool beyond today. Thank you for your time.